when you look at the curve of the country, yeah, there is some indication of flattening. But given the nature of our archipelago, maybe it's more instructive to look at specific areas like NCR, Calabarzon, where majority of the cases are located, Metro Cebu. Metro Cebu is a very, very instructive case. In the first 2 weeks of this pandemic, back in March, it had an R less than one, no, one or less than one, and it was doing very well. Then
How is it
suddenly, an outbreak, I should say, in a jail and in one barangay completely changes the picture. From one now, it's what, Guido, three? What?
Wow.
Where is it now, Gids? I don't know where it is now. It's
Yeah,
three?
it's about 3, and the number of cases is increasing very rapidly. So
But
not just Cebu City, but the whole province of Cebu.
And you attribute that to what?
Well, it could be a number of issues, but certainly where they're not handling the quarantine there as efficiently and effectively. It's something we need to take seriously. It could happen to NCR. So our basic, sige, sabihin na namin, no, hindi pa namin nilalabas, pero our basic caution in our report tomorrow is that we caution government with regards to relaxing the ECQ in the areas that are now under ECQ without, number one, adequate data, and number two, without safeguards in place. And for the last 3 forecasts, we've been hammering on particular safeguards. Number one, we need to have mass randomized testing. And we laud government because this week nag-improve from an average of 2,000 to 3,000. Now we're hitting 8,000. It's still less than what we feel should be, but at least we're getting there. Number two, effective contact tracing. This is what we can learn from many of the countries that we are observing. Those that are successful in managing this pandemic took testing, tracing, and supportive isolation very seriously. So that is a big problem in the Philippines. We have to say, while there are efforts and initiatives being made, we're not satisfied with the contact tracing initiatives of government. And I think that was dealt with by the president last night. That's why he was asking the DILG to take responsibility for it. But we need an army for that. Third is, of course, isolation, and we're trying very hard to build facilities. Please take in mind that there are something like 20 to 30,000 OFWs coming to the country. We don't know if some of them are affected, but if they are, we need to welcome them, but we need to make sure that they have facilities where they can self-isolate. This is a big thing. We're probably one of the few countries in the world still accepting people from outside. The number one thing about pandemic management, apparently in the literature, is that you close your borders. Nobody comes in. Nobody goes out. But we have to, these are our heroes. We have to welcome them and take care of them. So, our basic argument, Professor David's argument and our own, is that it's too early to relax the ECQ. We need time. We need time to roll out these safeguards. We need time to do mass testing. We need time as researchers to get the data, because the data right now does not support anything. Let's say that the DILG, some people in the DILG are suggesting now we open up certain cities.
Yes, that's right.
It would be a risk. It would be
feasible. It's not even feasible.
The implementation thing is one issue, but just looking at the numbers, it would be catastrophic to open it prematurely.
Yung forecast namin currently we're forecasting for June 15. If we continue the ECQ and it improves somewhat, we're total number of cases in NCR will be around 11,000. So yun yung total number of cases by June 15, 11,000 with about 800 deaths. Currently ngayon, nasa mga 6,600.
10,000 na tayo, di ba?
Sa whole Philippines yung 10,000. Ito sa NCR lang itong forecast na to. Yes, so from 6,000. Yes, ito yung actually pinaka-forecast namin. Yung improving, yan yung pinaka-forecast na. It's more or less flattening if we look at the blue curve. Pero if we lift the ECQ, this is just one possible projection. we could reach about 24,000 cases by
Oh,
June
wow.
15, and that will include mga 1,700 deaths within ano lang yan, mga 1 month lang yan, because we are increasing mobility. I mean, yung forecasts are very dependent on yung mga assumptions and yung mga factors, pero this is just one possible forecast that we put forth.
And that's just NCR.
Yes.
Oh, wow. So what kind of, if we're going to lift, and assuming that the number of health facilities remain the same, what is the worst case scenario in terms of breaching protocols pag minodify na at inis na yung ECQ?
It's hard to say. Yeah, it's hard to answer that. Government has set guidelines for what we call a modified, or a community ECQ, community GCQ, no.
Yes.
And many of these guidelines are still a work in progress. I mean, even in that, for that alone, we have to give time for government to fine tune and roll this out. The numbers Guido said are important numbers. Just for NCR alone, 24,000 cases. Now we're only 10,000, and in a month's time we'll have 24,000 if we prematurely relax. We will have more deaths
Yes.
if we prematurely. Now you put that together with the estimate of the economic team, the valuation of extending for another 15 days, possibly close to 100 billion will be lost. But what government will be able to decide in favor of livelihood when so many lives will be lost? And this is just one possibility. And our own models are quite conservative. The other models out there would probably project an even higher transmission rate and a higher number of people dying. Can we afford more people dying? Can we afford the context where more people are sick? So
I echo what their sentiments are. It might be too early. We've just seen some LGUs that are performing better than others in trying to decrease yung rise of the number of new cases. So basically, that's how you say yung flattening of the curve, no? Na medyo nakikita natin that it's not as steep as before. Unfortunately, for the major cities like Quezon City, Manila, maybe the other cities also around us, like in Bacoor, in San Pedro, Laguna, nakikita natin talaga na tumataas siya. And here, itong nakita natin parang trend sa Cebu City. So in the major urban areas, that's what we are observing, that there is really a trend of increase. And parang unimpeded pa rin. The smaller LGUs, medyo getting better, but we're still not out of the woods kasi magkakatabi kasi yung ating mga LGUs. So if you were to declare na pwedeng ma-lift na siya from ECQ to GCQ to a general community quarantine, pero yung how they commute, how they travel from one point of Metro Manila to another, that might be a cause for concern. So it won't be practical if we try to have a partial lifting, unless we can have a point-to-point system lang where we ensure that where we monitor yung travel of people from one GCQ area to another GCQ area. But right now, we don't have that mechanism yet, not in our LGUs.